Okay, so good day everyone. So this is the continuation of our discussions skull series for radiographic positioning. So last time we have discussed the basic positionings and projections and views for skull examination. So this is the continuation. So first we will start with the submental vertical basilar position or Schuller method. So submental vertical, this is a projection, meaning the central ray, the X-ray, enters the submento or the submentum and it will exit the vertex. So it is also referred to as the full basal projection, submento vertical projection, or basilar position or Schuller method. So basilar position because the base of the skull is the one that is near or resting the table. So the position is that the chin is raised and the neck is hyperextended. The MSP or the mid-sagittal plane is perpendicular to the image receptor, while the IOML or the infraorbitomeatal line is parallel to the IR. So the central ray is perpendicular to the IOML, which enters 3/4 inch anterior to the level of the external auditory meatosis or the EAM. So you can say that uh, the procedure is a success with this criteria. First, the IOML is nearly as parallel to the table as much as possible, and the central ray is perpendicular to the IR. So this basilar position or Schuller method or SMV, submental vertex or submental vertical projection, demonstrates the basal foramina. So the foramina, these are the openings. So it includes the foramen ovale, and foramen spinosum, as well as the carotid canals. Also, it demonstrates the sphenoid maxillary sinus, the ethmoid sinus, the dens, and the atlas, or your C1 and your C2. The mandible condyle or the mandibular condyle is placed anterior or can be seen anterior to the petrous pyramid. So these are the criteria that we can tell that the position or the projection or the procedure is a success, meaning you have positioned the patient correctly and you have placed the central ray accordingly. So the opposite of the submental vertex or the submental vertical projection is the vertico-submental. So the VSM is the opposite of SMV. So it is also referred to as the full basal projection, basilar position, or Schuller method. So pinagkaiba lang is that their position or the entrance and the exit of the central ray are opposite. So sa submental vertical or sa SMV, the base of the skull is placed near the table, while sa vertico-submental or sa VSM, the chin is placed on the table. So bali medyo nakadapa yung patient sa VSM, sa SMV nakasupine yung patient. So sa VSM, so the chin is fully extended on the table, nakapatong siya sa table, but still the MSP is perpendicular to the IR. And also the IOML is parallel to the IR. So with this position, with this projection, with this method, so it demonstrates a distorted as well as the magnified image of the mid-base due to the increase of ID and angulation of the central ray. So medyo magnified and distorted na yung mid-base dahil nga malayo siya sa IR kasi yung patient is naka-prone. This study is useful to demonstrate the anterior cranial base and the sphenoid sinuses, as well as to demonstrate the foramen ovale and the foramen spinosum. So mas maganda siya yung VSM to demonstrate the foramen ovale and spinosum compared sa SMB dahil mas malapit sila sa IR. So central day is still the same. Sabi ko nga yung position na ng pasyente yung nagkaiba between VSM and SMB. So perpendicular to IOML, 3/4 inch anterior to the level of external auditory meatus. Another position for the skull is the lysium method. So nakalateral yung patient, kaya tinatawag siyang axiolateral position. So as you can see there, yan yung position ng patient. Di ba pa sinabi natin axial or axiolateral. May angulation yung central ray. So the EAM is centered to the midline of the table. MLT is the midline of the table. MSP is parallel to the IR kasi nga nakalateral yung patient. IOML is also parallel to the IR because the neck is extended. The interpupillary line is perpendicular to the table. So as you can see there, the IPL is perpendicular to the table. So since it's an axial projection, so the central ray is 30 to 35 degrees caudal, which exit at a point 1 inch distal to the lower EAM. So papasok siya dito, ako ng pen. So papasok siya dito as you can see, and then dito yung isang ears niya. So dito siya mag-exit. So 1 inch distal to the lower EAM. So it demonstrates the oblique position of the lateral base of the cranium, which is closest to the IR. So ang best demonstrated niya is the lateral part of the base of the cranium that is near the IR or closest to the table. This is also an alternative projection for SMB, especially for the patient who cannot extend their neck. So kapag yung patient is hindi kaya yung SMB, yung submentovertex projection, dahil hindi niya kayang extend yung kanyang neck, so ito yung ating alternative, yung axiolateral position or the lysium method. So that is for the skull. Okay? So next we'll proceed sa sella turcica. So sella turcica, as we have discussed previous lesson natin, so can be found sa skull also. So first projection is the lateral projection. So the patient's head must be in true lateral position. So naka-semi-prone siya. Parang pareho siya ng lysium. Kaya lang walang central ray. Walang angulation ng central ray. So as you can see there, MSP is parallel to IR, katulad ng ating lysium. Then IPL is perpendicular to the IR or the table. The IOML is parallel to the long axis of the cassette. So again, para siyang lysium. So again, pinagkaiba ng lysium sa sella turcica na lateral is that walang angulation ang central ray sa lateral projection ng sella turcica. So instead, so it is perpendicular, directed 3/4 inch anterior and 3/4 inch superior to EAM. So again, the purpose of lateral projection is to demonstrate the sella turcica as well as the anterior and posterior clinoid process, the dorsum sellae, and the clivus. Deformity of the sella turcica can also be seen in this projection, and this is often the only clue that the lesion exists intracranially. So ibig sabihin, for example, if we perform sella turcica lateral projection and then nakita natin na nag-deform yung sella turcica, so most likely it means that there is a lesion present in that area. So ito lang daw yung pinaka-common, pinaka-obvious na palatandaan na merong lesion na nag-exist intracranially kapag nag-deform yung stellar torsica as it can be seen dun sa ating lateral projection. Also, depression of the stellar torsica and dorsum sellae are best seen from the lateral projection. So kapag bumaba siya sa kanyang normal na placement, yung stellar torsica at dorsum sellae, makikita siya sa lateral projection. Another one is the Towns method or Grashy method or the apiaxial projection. Ito siya. So patient is in supine position, MSP perpendicular, OML, and IOML are also perpendicular. So for example, if the OML is the one perpendicular to the table or to the IR, the central ray is angulated at 30 degrees. Diba? Again, pag sinabi natin axial, meron siyang angulation. Pag IOML naman, yung perpendicular, so the angulation is 37 degrees because just like what we have discussed before, there is a 7 degrees na difference between the OML and IOML. So, ang OML at IOML na pag-perpendicular niya sa IR, depende yan sa condition ng patient. Meron kasing times na hindi kaya ng patient na magposisyon kung saan magiging perpendicular yung OML niya. So yung IOML, yung gagamitin natin na palatandaan, so 37 degrees. Pero kapag kaya ng patient, ang OML, so 30 degrees lang yung angulation. So central ray is 30 degrees, again, if OML. If IOML, 37 degrees to enter 1.5 inches above the superciliary arc and will exit through the foramen magnum. As you can see sa ating picture. So kapag 30 degrees caudad, so pag sinabi natin caudad, so papunta sa baba yung direction ng kanyang central ray. So mas makikita yung anterior clinoid process. Kapag naman IOML, 37 degrees, yung makikita is also the clinoid process together with the dorsum sellae. So next is PAHL Haas method. So this is the opposite of Towns or Grashy method. So ang Haas naman, PAHL. Ang Towns or Grashy, APHL. So as you can see, nakadapa yung patient. So this is the reverse Towns. So again, yung opposite ng ating Grashy or Towns method is the Haas method. So patient in prone position, as you can see here sa picture sa inyong right, the forehead and nose resting on the table, MSP and OML perpendicular to the IR. So meron tayong dalawang central ray. So 25 degrees cephalad ang central ray, as you can see sa picture. So it will enter 1.5 inches inferior sa baba ng inyon, which will exit 1.5 above the nasyon. Pag 10 degrees naman cephalad, so makikita natin yung dorsum sellae above the foramen magnum. Pag 25 degrees cephalad, dorsum sellae and posterior clinoid processes is projected within the shadow of the foramen magnum. So ibig sabihin, if ang angulation natin is 25 degrees cephalad, so sa loob mismo ng foramen magnum, sa shadow niya, makikita yung dorsum sellae and posterior clinoid process. Pero pag 10 degrees, yung makikita natin na dorsum sellae is above the foramen magnum. That is for stellar torsica. So, lateral, apiaxial, and PAHL. Next, for PNS. PNS is paranasal sinuses. So, paranasal sinuses, these are large air-filled cavities. So normally, yung ating sinuses, air ang kanyang laman. Pero halimbawa, there are times na pinapasok siya ng tubig, kaya minsan nahirapan tayong huminga or yung pagsasalita natin, medyo nag-iiba na because there are fluid inside the sinuses kasi dapat air lang. So PNS are also called accessory nasal sinuses because they are lined with mucous membrane and they communicate with the nasal cavity. So meron tayong different paranasal sinuses. Meron tayong maxillary sinuses, frontal, ethmoid, and sphenoid sinuses. So other term for maxillary sinuses is the antrum of Highmore. So this is also prone to infection, yung maxillary sinuses, and it can reach the adult size. So lumalaki siya hanggang mag-edad tayo ng 12 years old. Then pag umabot ng 12 years old, so yun yung kanyang pinaka-maximum na size. For frontal sinuses located behind the glabella and superciliary arches of the frontal bone, and it can reach adult size with the age of 15 or 16, and very rare lang daw na may hangin siya before the age of 6. Usually, ang frontal sinuses, so nagkakaroon na ng hangin when we reach the age of 6 years old and above. For ethmoid sinuses, these are composed of 6 to 8 thin-walled air cells that occupy the bony labyrinth of the ethmoid bone and can reach adult size at the age of 14. While for sphenoid sinuses, lies in the body of the sphenoid directly below the cell lateral ceca, and also adult size niya is at the age of 14. So PNS should be radiographed in erect or upright position. So makikita lahat ng sinuses or ang recommended na position for demonstrating all the paranasal sinuses is the erect position kasi makikita yung air fluid level. So to differentiate between shadows caused by fluid and those caused by other pathologic conditions, kaya pina-perform ang PNS and patient again must be erect in at least 5 minutes para bumaba yung fluid level and then nasa taas yung hangin. Kasi halimbawa, nakahiga yung patient tapos papabangunin, then expose agad. So hindi pa lahat ng fluid nakababa na. And hindi lahat ng hangin nasa taas. So kailangan allow the patient to be in erect position for about 5 minutes bago siya i-expose. So the routine for PNS are lateral projection, Waters, and Caldwell projection. So again, actually sa SKull series kasi, paulit-ulit lang naman yung mga examinations. So yung nag-iiba lang yung central ray and then yung best demonstrated na organs or area of interest. So sa lateral, patient and semi-prone position kapag nakahiga yung patient. Pero again, mas recommended na nakatayo siya or nakaupo basta naka-erect position. MSP and IPL perpendicular to IR. MSP is parallel, IPL is perpendicular, IUML is parallel. Central ray horizontally directed 1 inch posterior to the outer canthus. So, bali sa gilid ng mata natin, sa outer canthus, 1 inch posterior, yung central ray. Perpendicular lang. Best demonstrate all 4 sinuses, which are the maxillary, frontal, ethmoid, and sphenoid sinuses. So again, what is the best projection to demonstrate all the 4 sinuses or 4 PNS? So lateral position or lateral projection, or para mas kompleto, mas maganda, lateral erect. Demonstrate the sphenoid sinus, which is the primary importance of the lateral projection. So yung pinaka-importante na makita sa lateral is the sphenoid sinus. It provides also a lateral projection of superimposed facial bones. Next, sa Caldwell. Caldwell is PAHL. As if you can remember, dun sa ating discuss sa skull series, may Caldwell din. So, pareho lang siya actually. So, 0 degrees and 15 degrees. So, horizontal central ray, tilt the head, unit, 15 degrees to open postero-inferiorly. Rest head on forehead and nose, as you can see dun sa picture. So, yung part ng face na nakadikit sa IR is the forehead and nose. The OML forms an angle of 15 degrees. So, kapag nakatilt yung head ng patient, katulad sa left na picture dyan sa baba, so wala na siyang angulation. So, horizontal lang directed to nasyon. Pero halimbawa, if hindi kaya ng patient or yung hindi kaya ng ating unit na mag-tilt ng 15 degrees, so yung ating central ray may angulation of 15 degrees. So, dito, OML perpendicular to table, demonstrate the frontal sinus and anterior ethmoidal sinuses. Also, one of the most important things dapat makita is the petrous ridge projected into the lower one-third of the orbit. So, sa Caldwell, makikita ang petrous ridge sa lower one-third of the orbit. So, sa mata, banda, sa lower one-third, makikita yung petrous ridge. So, modification of the PA projection, di ba PA ito, PAHL. So, CR is perpendicularly directed to nasyon to best demonstrate the posterior ethmoidal air cells. So, again, another term for sinuses is air cells. So, inferior to cranial bone. So, 10 degrees na pala directed to glabella to demonstrate the sphenoidal sinuses. So, perpendicular, midway between IOM. So, to demonstrate naman maxillary sinuses and anterior ethmoidal air cells. So, pag 10 degrees, posterior ethmoidal air cells. Pag 0 degrees, perpendicular lang siya, 0 degrees, so makikita ang anterior ethmoidal air cells. Then for parieto-acanthial projection or Waters method, or other term for Waters method is Mahoney method. So as you can see there, patient in prone position. So again, pag PNS, mas ideal na naka-erect yung patient. So kanina sa Caldwell natin, forehead and nose. Sa Waters, chin naman. Chin is resting on the table. The MSP is centered to the midline of the table. MSP and MML or mentally line perpendicular sa IR. The OML forms an angle of 37 degrees with the plane of the film. Kasi naka-tilt yung head ng patient. So central ray is horizontal, directed to exit the acanthion, as you can see there. So it best demonstrates the maxillary sinuses above the petrous ridge. Also used for projection for demonstrating the foramen rotundum, and it is the best single projection to demonstrate the entire facial bone. So if we want to see the whole facial bones, so mas preferred Waters method or the Mahoney method. So there is a modification for Waters, which is what we call the open mouth Waters projection. So, syempre, from the name itself, so nakanganga yung patient. So, the same position sa Waters, kaya lang nakanganga yung patient. So, central ray, pareho pa din to exit acanthion, but it demonstrates the sphenoid sinuses through the open mouth. Mas makikita siya, and the petrous ridge can be seen below the maxillary sinus. So, dito sa ating waters, sa original na waters, maxillary sinus above the petrous ridge. Dito naman sa open mouth, the petrous ridge is below the maxillary sinus. So, in addition, we also have the Peary method or the eggshell transoral position, where the head is resting on nose and chin. So, ang Caldwell, forehead and nose. Ang water is chin. Ang Peary is nose and chin. So, MSP is perpendicular to IR. So, patient is instructed to phonate ah. So, yung instruction sa patient, say ah. So, kapag nag-ah yung patient, then mag-shot tayo. Instruct the patient to open mouth. Siyempre, kasi kailangan niya magsabi ng ah. So, nakanganga siya. So, the central ray is directed to the MSP. There is also a caudal angulation depende sa shape ng face ng patient. Also, it demonstrates an eggshell image of the sphenoid sinuses projected through the open mouth. We can also see sa Peary method the maxillary sinuses and the nasal fossa. And we also have last sa PNS, SMB projection. Pareho pa rin siya ng position natin ng SMB kanina sa skull. Ang pinagkaiba lang is yung central ray natin. So, perpendicular between the angles of the mandible or sagonion. So, best demonstrate a basal projection of the sphenoid sinus and ethmoid sinuses. So, yan sa ating PNS. We have the lateral waters, then open mouth or the modified waters. We have the Caldwell here. Then, in addition, we have the Peary and the SMB projection. That is for PNS. Next, the facial bones. So first, we have the lateral projection. So the same pa rin ang lateral na pinag-uusapan natin kanina. The same ang position ng patient. Central ray. So ang central ray lang nagkaiba. So perpendicular directed to the mid-zygoma to demonstrate a superimposed image of the facial bones. Ang waters, the same pa rin ang posisyon. Yung central ray lang, perpendicular directed to acanthion. Okay, if you can remember, pareho lang yung posisyon described. Yung central ray nagkakaiba and then yung ating best demonstrated structures. It demonstrates an eggshell image of the facial bones, the orbits, maxillae, and zygoma. So the waters projection, as nasabi ko kanina, best single projection for demonstrating all the facial bones. And also mentioned earlier, maxillary sinus is seen above the petrous ridge. Another one is the modified waters projection. So the same position siya, pero the OML forms an angle of 55 degrees with the IR. Then the lips sumiata line is perpendicular to the table. So central ray is the same, directed to acanthion, pero since there is the difference in angulation, as you can see sa waters, OML is 37 degrees. Sa modified waters, OML is 55 degrees. So it demonstrates facial bones with less eggshell angulation. Petrous ridges immediately below the inferior border of the orbits. Hindi siya sa lower one-third, hindi rin siya above. So makikita siya just below the inferior border of the orbits. Also to demonstrate a more direct view of the orbital rim as compared with waters projection. So another one, we have waters, modified waters. We also have the reverse waters projection. So sa reverse waters naman, so it is also referred to as the APH projection. So this is to demonstrate facial bones when the patient cannot be placed in prone position. Kasi di ba yung waters natin, yung patient nakaharap sa IR. So dito naman yung ating patient, kung hindi niya kaya mag-prone, so ginagawa natin yung reverse waters projection. Patient in supine position, MSP is centered to midline of the table and the IOML is perpendicular to the IR. So central ray for reverse waters is 30 degrees cephalad to enter slightly below the lips and exceeds 2 inches above the inion. As you can see there sa ating image. The central ray is parallel to the MML or the mentomeatal line. So it demonstrates facial bones when the patient cannot be placed in prone position as mentioned, as well as axial position of the superior facial bone, just like sa ating waters, although the structures are magnified because of the increased OID. Kasi nakaharap yung patient which is supposedly dapat naka-prone siya. So since hindi kaya, so kukunin natin siya sa supine position. So kaya lang there is a magnification of the structures. So that is for facial bones. Next, for nasal bones, so lateral, the same pa din ang position. Again, nagkakaiba lang sila sa central ray and sa structures demonstrated. So for STL or soft tissue lateral, so central ray is perpendicularly directed 1/2 inch distal to nasyon. So soft tissue structure of the nose is demonstrated, also the nasal bones, the nasofrontal suture, and the anterior nasal spine. Another one is the superior inferior tangential projection. So patient in prone or upright, seated on chair, the glabello-alveolar line perpendicular to IR, MSP also perpendicular to IR, and the IOML is parallel to the IR. So central ray, so center lang sa nasyon, and parallel to glabello-alveolar line. So it can demonstrate portion of the nasal bones that extends beyond the glabello-alveolar line and also to demonstrate the medial or lateral displacements of fragments in fractures. So kung yung mga fractures sa nasal bones, so mas maganda itong superior inferior tangential projection to demonstrate the medial or lateral displacement of fragments in fractures. Ayan siya. Next is zygomatic series or the submentovertex projection. So again, the same position ng SMV na sinabi natin kanina dun sa skull. So yan yung positionan ng SMV. So it will position the MSP perpendicular to IR and IOML is parallel to the IR. So central ray perpendicular to IOML to a point midway between zygoma 1.5 to 2 inches inferior to the mandibular symphysis. Ito siya sa inyong right na image. Central ray yan, so it demonstrates symmetric tangential images of the zygomatic arches free of superimposition. So take note, the use of a decrease in exposure factor is recommended in this projection. So magdi-decrease tayo, babawas tayo na ating exposure factor. Next is modified Piterington method. So patient naka-prone, as you can see there's a picture, head resting on nose and chin. MSP perpendicular to IR, central ray. So yung tandaan niyo is central ray. So 23 to 38 degrees caudad to enter the vertex, as you can see sa picture. So a 23 degrees caudal angulation will produce an image similar to water's projection. Next is tangential position, oblique infero-superior projection. So yung patient, naka-SMV or submental vertex, head resting on vertex, IOML parallel to the IR. So rotate the head or the MSP, hindi siya perpendicular. So the MSP is rotated 15 degrees towards the side being examined, and then tilt the chin 15 degrees towards the side of interest. So yung near the table is yung area of interest, and then tilt siya 15 degrees towards the side of interest. So the CR perpendicular to IOML and center to zygomatic area of interest. So this is useful for patients who have depressed fractures or for patients with flat cheekbones. Remember, we are talking about the zygomatic arches here. So kung yung patient have flat cheekbones or may depressed fractures sa zygoma, so ang recommended is tangential position, oblique, infero-superior projection for the zygomatic examination. Next is the towns. So pareho pa din ng towns natin na pinag-usapan kanina. So yung central ray niya, 30 degrees caudad, 37 sa IOML, 30 sa OML, to exceed 1 inch above the glabella. Next is the modified push method. So patient naka-prone, as you can see there's a picture. So the cheek of the affected side is on the table. The sigyon is centered at the IR. Sigyon is the most lateral point of the zygomatic arch. So the alveolar, wait lang. Alveolar meatal line is perpendicular to the IR. So head is rotated so that the MSP forms 45 degrees. Then tilt head 15 degrees. And central ray is 35 degrees caudad. It enters the most prominent point of the zygoma, which is the sigyon. So ang bali dito sa ating modified push method, so ang interest niya best demonstrates the sigyon farthest from the film. So hindi yung near the film. Next is the May method. So May method, patient in prone position, neck is extended as you can see there sa ating picture. So chin is resting on the table, the head is rotated to the side being examined so that 15 degrees, so that the MSP forms 15 degrees. Then the head is tilted also 15 degrees, tangent to the lateral surface of the skull. The OML, as nearly possible, parallel siya dapat sa IR. Central ray is perpendicular to IOML to 1.5 inches posterior to outer canthus. So it demonstrates the zygomatic arch free of superimposition, and this demonstrates also para sa mga patients with depressed fractures or flat bone. So ang May method, parang pareho siya ng ating tangential position, oblique infero-superior projection para sa mga flat cheekbones ang May. So that's it for zygomatic arches. So the next natin na i-discuss is the mandible sa next na slideshow. Laksa na yun.